So welcome to this session. We're going to look at Nightingale's theory. Nightingale theory is one of the commonly used theories of nursing. It is very highly applicable in nursing care or in the provision of nursing care. So in this session, we're going to look at what the theory is and why it is actually very important, and what is the overall contribution of Florence Nightingale to nursing practice, nursing profession. And then we'll look at how Nightingale defined, how Florence Nightingale defined health, environment, and nursing, and then the person. And then we'll look at the 13 canons of environment and how they affect health. And then we'll look at how nurses can apply Nightingale's theory in different settings and situations. So the nursing profession as it stands currently has a lot of foundation, has a lot of its foundation being laid by Florence Nightingale. She was born in Florence, Italy, in 1820, and one was born on 12th May. Okay, and you need to remember that 12th May is the International Nurses Day, and this is in remembrance of her contribution to nursing profession. In different literature, she is actually referred to as a lady with the lamp because of her dedication to nursing. And she was not only a nurse, but she was also a competent person in statistics, and used things like bar graphs, bar charts to really convey health information. Okay, she passed away in 1910 on August 13th. And the theory that we are going to look at, Florence Nightingale's theory of nursing, rotates around the concept of environment. Okay, and in her theory, she recognizes that the patient is the central focus, and the interventions of the nurse will rotate around manipulating the environment for the well-being of the patient. Okay, she really understood that human beings interact with the environment, and then the environment influences their health. Okay, so this kind of interplay is what she focused her nursing theory on. Okay, so the environment does not only rotate about the physical environment or the physical surroundings, but also it has dimensions to do with the social environment, with the psychological environment or psychological aspects to it. Okay, so she believes, though she perceived that patients' needs are interconnected, and emphasize the role of nursing in meeting the needs of the patients. So there are 13 canons of the environment that she believed that need to be manipulated in order to improve the patient's outcome. So one is ventilation, which is that proper ventilation and fresh air is very essential for maintaining a healthy environment. Allowing air to move and circulate around carries away microbes that can cause diseases. Okay, so being in in an overcrowded place without proper ventilation is a risk for acquiring airborne diseases. And then we move to light. She believes that adequate natural light is actually very important for a patient's well-being and recovery. Okay, the natural light enhances what we call the circadian rhythms, enhances mood, and supports overall healing. The circadian rhythm relates to the sleeping patterns. Okay, so if you have this natural light happening, it's very easy to get that sleep. The circadian rhythm is actually properly functioning. And then we have noise. That excessive noise can disrupt patient's rest and recovery. So we need a quiet environment for healing to happen. Cleanliness, of course, we know that diseases can spread if we don't maintain proper hygiene. So we need to make sure that damp blasting is done, mopping, and disinfection, hand washing. These are all very important practices in preventing the spread of diseases and infections. Ensuring that the patient is comfortable is also very key. Comfort relates to the procedures that we do, the beddings where the patient is lying and things like that. And then you move to nutrition. Nutrition also plays an important role in healing and in improving the immune response. The beddings should be clean, okay? The bedding should be clean and comfortable, okay, for the patient. And then chattering of hopes, which is encouragement and positive commitment and positive communication, play an important role in patients' psychological well-being and recovery. This is the recognition of psychological well-being as one of the dimensions of health. So basically, Nightingale looks at health in more than one dimension. Looks at the psychological part, the physical part, okay, and social part. Okay, so nutrition is very important. And then we look at hydration, providing enough fluids. It's very key for health. And then personal hygiene, helping the patient with the hair, with the nails, with the bats. These are very key. And then maintenance of the environment. The environment should be free of anything that can cause any harm to the patient. And then the control of the environment. Okay, and the nurse can make sure that they can make adjustments to improve health and well-being. And Nightingale also emphasized the technique of observation. Careful observations are very key in nursing. The nurse should be able to see or to make observations about the patient and then respond by taking action. Okay. So basically, Nightingale looked at nursing as a profession that is not only limited to making medical decisions. It involves making sure that the environment is optimal for the patient. So Nightingale believed that nurses are independent, it is autonomous, they are educated, and they are creative individuals who use critical thinking in order to carry out their activities. Okay, so that is the Nightingale's theory. Thank you very much for listening.